Hi, I'm Dr. Mu, a gastroenterologist in Everett, Washington. I am here to give you a general introduction to colonoscopy bowel preparation and about how to improve your bowel preparation quality. There are several quality measures to ensure a high-quality colonoscopy. The most basic and critically important measure is good colon preparation. This requires your diligent cooperation. Based on current practice guidelines, a colonoscopy must be repeated if the bowel prep is inadequate. You will be asked to repeat a colonoscopy the next day or within 1 year, depending on how poor the bowel preparation is. I will first show you some good and bad prep examples. This patient had excellent bowel prep and as a result had a high-quality colonoscopy exam. Here are 4 examples of poor bowel preparations. As you can imagine, colon polyps can be hidden behind the stool particles and easily missed. In the left upper panel, the stool was watery but cloudy liquid with stool particles. This is inadequate. As shown in the right upper panel, medicine granules were present, which made visualization difficult and often clogged up the scope channels. For similar reasons, large vitamin pills, corn, peas, nuts, and whole-grain foods often make the bowel preparation unacceptable, as shown in the left lower panel. In the right lower panel, marble-like stool balls were retained in the colon. This is often caused by constipation and/or significant diverticulosis. How do you know if your bowel prep is adequate after you complete the bowel preparation? Here is a research study published in 2015. You can assess your bowel prep quality by looking at your toilet bowl. Picture A in the upper panel is good. Pictures B and C in the upper panel are probably adequate. Pictures D and E in the lower panel are likely inadequate. Anything worse is inadequate. Some patients mistakenly believe any watery bowel movements mean adequate bowel preparation. The colonoscopy is an underwater camera exam. If the water is murky, the doctor cannot see. Sometimes stool particles come out in batches. Even if your stool comes out clear halfway through the prep, it is still important to complete the entire prescribed bowel prep solutions. Now, let's talk about how to get an excellent bowel preparation. Dietary modifications 1 week before the colonoscopy are critical. We humans don't digest plant-based foods very well. Absolutely avoid any seeds, nuts, peas, corn, and whole-grain foods for 1 week. Also avoid taking any non-essential supplements formulated in tablets or granule capsules. Soft and well-cooked vegetable leaves are okay, but avoid potato skins and chewy vegetables. On the other hand, we do digest meat very well, so there are no restrictions on meat consumption. Also, watch out for constipation. If you have constipation and do not have daily bowel movements in the week prior to the colonoscopy, your bowel preparation will probably fail. You should take over-the-counter laxatives or stool softeners to have at least 1 bowel movement per day. Commonly available stool softeners include Miralax, Colace, Dulcolax, etc. The bowel preparation instruction tells you to consume a low-fiber diet, which can cause constipation. You can replace dietary fiber with commercial soluble fiber powders such as Benefiber or Citracel, 1 tablespoon, twice daily. On the day prior to the colonoscopy, you should be strictly on a clear liquid diet. Some patients become hungry and eat solid foods. This will ruin your bowel preparation. If you're really hungry, in the morning before you start the bowel preparation, you may drink a few cans of Ensure, which is a supplemental nutrition drink available in grocery stores or drugstores. In the afternoon or after you start drinking the bowel preparation, you may drink some clear sugar water to relieve the hunger sensation. We do have extra-dose bowel prep protocols for certain patients. Several conditions and medications often cause bowel preparation failures, such as constipation as discussed above, severe diverticulosis, Ozempic or other GLP-1 agonists for diabetes or weight loss, or a history of failed bowel preparation in the past. If any of these issues apply to you, please ask for an extra dose bowel prep protocol. You may also notice that we have added simethicone to the new bowel preparation regimens. This is based on recent studies showing improved adenomatous colon polyp detection rates. As you can see in this patient's colon, solid stools were eliminated successfully. Yet visualization was still severely limited due to the presence of gas bubbles covering the entire colon. They are caused by bile, which serves as biological soap in our intestines to help digest fatty meals. As you can imagine, soap creates bubbles. Water irrigation often generates more bubbles in this situation. Simethicone is very effective in preventing and clearing them. It also improves colon polyp detection rates. You can buy liquid simethicone from almost any drugstores. The brand name is Mylicon. It is a liquid medicine and it comes with a small syringe for measurements.